Good evening, everyone. I am Bhavna Dabas, an intern at Tanuwas India and the current secretary of Veterinary Association of India Student Forum. I'll be your host for today's session. On behalf of VAI, I warmly welcome you all to the day 2 of National Online Symposium on Exotic Veterinary Practice. Before we begin, I would like my co-host, Ms. Ashita, to briefly introduce herself to everyone. Ashita, over to you.
Good evening, everybody. I am Ashita. I am a third year veterinary student from Apollo College of Veterinary Medicine. I am representing VAI as local chapter in my college, and I'm also the organizing head for the committee this season.
Thank you, Ashita. Ashita will be assisting us with the Q&A session today. We're also joined by a moderator from VetNet, our digital partner, who will be assisting us throughout the session. We sincerely appreciate their support. Today's session has been structured into two parts. We'll begin with Dr. Stalin's presentation, followed by a Q&A session. After that, we will have Dr. Rina's presentation with another Q&A session. Then we will conclude this symposium with a vote of thanks by Ashita. Kind information, all registered participants will receive their e-certificates within 1 week. Over to you now, Ashita, to introduce our speakers for today's event.
Before I introduce our esteemed speakers, there's an announcement I would like to make. For any of you having questions during the session, there's a comment option below on your screen. So kindly drop your questions there and our coordinator will pass it on to us. It's my esteemed pleasure to introduce Dr. S. Stalin Velladurai. He is a distinguished veterinary surgeon and the founder of Petzmart Pet Clinic, Chennai. With over 20 years of experience, he specializes in small animal and exotic avian medicine, bolstered by an externship at the Abu Dhabi Falcon Hospital. Dr. Velladurai holds an MBSc in epidemiology and preventive medicine and a PGD in wildlife animal disease management. Beyond clinical practice, he holds key leadership roles in SAPACTN and FSAPAI, contributing to the global advancement of veterinary standards through his membership in WSAVA. Without further delay, I now begin Dr. Stalin Velladurai to begin today's first session. Over to you, Doctor.
Thank you, Ashita, for your wonderful introduction. Now, just we move on to our topic basics of avian practice. So, in this session, we are going to deal with the basics and also restraining procedure and also how we are going to clinically examine a pet bird. So, this avian practice now is gaining a lot of importance among the veterinarians. Earlier days, we used to get very less number of bird clients. Now, out of 10 clients, we are getting 2 pet birds. So, this is going to be an eye opener for all budding vets and also beginners and also vets who are practicing across India. So, now we are going to deal about basic things, which are things much needed in an avian practice. So in avian practice, the foremost important things in a day-to-day practice is in identification, how we are going to handle a bird, and what are all the minimum equipments which is required, and how we are going to collect the samples, and what are the diagnostic methods we are following, and at last how we are going to treat the bird. So identification is very, very important in an avian practice. So when you see a case like in a pet bird, you should be in a position to identify what kind of bird it is. So you cannot ask a pet owner what breed of bird it is. See, this will make the pet owner to lose confidence on you. So foremost important thing is you should know what kind of bird it is. Like when you say if it is a macaw, it should be a macaw. When you say it is a cockatoo, it should be a cockatoo. Don't worry about the subspecies. If you are aware of subspecies, that's well and good. Otherwise, basic thing you should know, identify what breed or what kind of bird it is. So now in identification, first thing we have to know about subspecies. What kind of bird it is and what variety of bird among the species it is. Second thing is sex differentiation. Here there are two things are there. One is monomorphic and dimorphic. Monomorphic means both male and female look same. Dimorphic means both male and female looks different. So it's easier to identify. But in monomorphic birds, both male and female will look like same. And you should know about the life expectancy, clutch size. Clutch size is the number of eggs and incubation period and nutrition. And many of the pet owners, they will ask many questions about the nutrition point of view. So gaining a knowledge on nutrition is very, very important. Like example, a bird owner will come and ask about what to feed and how to feed, how long should I feed, how to keep the feeding material, water material, everything. So you should have a very good knowledge about the nutrition. One example I'll tell you. See, the most of the exotic parrots and pet birds, they used to give only seeds. So when the bird is fed only on seeds, it is having high chances of fatty liver disease. So you should know what proportion of seeds has to be given, what proportion of green leaves should be given, what proportion of fruits to be given. This gives a very important thing to we can give a knowledge to the pet owner how to feed a pet birds. So, in our pet practice, our common exotic pet birds, what we see on a regular cases are budgerigus, cockatiels, African lovebirds, parakeets, Indian ringneck, but now it is banned now. African grey parrot, cockatoo, macaw, eclectus, and Amazon parrot. So these are the common exotic pet birds what we can able to see on the regular practice. So now we move on to each bird varieties. Now first thing very common in our pet practice is budgerigus. So they have an average lifespan of 5 to 8 years, and incubation period is 18 days, and clutch size is 4 to 6. See here it is a clear dimorphic bird, male and female looks different. See, you have to watch out cirri of the bird. Cirri is nothing but a fleshy part around the nostrils. If it is blue in color, it is male. If it is brown in color, it is female. So even the younger and older birds also can be differentiated. If the cirri is very fleshy, then it is younger bird, and it's crunchy, it is a much older bird. So another species of birds which commonly we get in our practice is cockatiels. So here also it's clearly dimorphic. See, you can see the this orange or cheek patch. If it is darker in color, it is male, and if it is lighter, it is female. So they also have a lifespan of 10 to 15 years, and clutch size is 4 to 7, and incubation period is 23 days. So these are the things common you should know about to have a fair idea about the birds. And African lovebirds. See here the sexual dimorphism is noticed only in certain breeds like Madagascar, red-faced, Abyssinian lovebirds. So they have the lifespan of 20 to 30 years, and clutch size is 4 to 6, and incubation period is 18 to 24. Mostly they feed on nuts and fruits and mixed feeds. So monk parakeet or quaker parrot. So this is also is nowadays very common in our practice, and they have a very good lifespan of 20 to 30 years, and the incubation period is 23 to 26 days. They are monomorphic, and one thing how we are going to differentiate male and female in monomorphic bird is by DNA sex. So it is a chromosomal method of identifying by PCR technique, by which we can differentiate sex in monomorphic birds. And the Indian ringneck, earlier days we used to get a lot of parrots as pets. Nowadays it is banned, but still it is a clear dimorphic bird in which the male will have the ring around the neck and female will doesn't have the ring at all. And African grey parrot, it is a very good market among the exotic pet birds because of its clear mimicking habit. They can mimic more than 3,000 birds, and birds and it's a very good pet bird, and which will live longer of 40 to 60 years. And sex people, they are monomorphic, but slightly we can differentiate male and female by the size of the head. If the head is slightly flat, it is male, and if it's slightly bulged out, then it is a female. So, but DNA sexing is the right method of differentiating male and female African grey parrot. And cockatoo, this is a wonderful bird, and it is a highly noisy bird, but they have also have a capacity to mimic many words, and the lifespan is 40 to 60 years, and it is a monomorphic bird. We have to differentiate sex by DNA sexing only. They also feed on fruits, nuts, and seeds. See, among these are the varieties of cockatoos, and among which sulfur crested cockatoo and Malaccan cockatoo is very famous among these cockatoos. But we can see a lot of other cockatoos also. Macaw, it is a beautiful, colorful bird, and it is expensive bird, and this is also talkative bird, and it has a very good lifespan of 40 to 60 years, and clutch size is 1 to 4, and it is a monomorphic bird, and many varieties of macaws are available, like many varieties of macaws you can see now, hyacinth macaw, blue gold macaw, scarlet macaw, and among which the common macaw is blue gold macaw, and the very expensive costly macaw is hyacinth macaw. And eclatus, this is a clear dimorphic bird, wherein male looks green in color and female looks red in color. And it has a good lifespan of 30 years, and the clutch size is 2, and incubation period is 26 months. So these are the common birds which normally we see in our regular practice. Now, what are the equipments required for the day-to-day practice? So the first thing is clean and fresh towel to handle the bird, and perch for the bird. This is nothing but a wooden stand where we will keep the bird to stand and to examine. And we need a weighing machine up to 10 kgs. This is very important because we have to weigh the bird from a smaller size to a larger size. Average maximum size of a bigger bird will be around 3 kgs maximum. And we should have a microscope for some sort of examination of feathers and a blood examination. And we should have scissors and nail clippers, and we should have some feeding syringes. In case of very weak and debilitated bird, we should feed infant feeding formula at the clinic. We should have some feeding syringes with us. So where which are the equipments which I have at my clinic is this kind of nail clipper, and this is a nebulization chamber which I developed at my clinic. This is a kind of inhalation therapy for weak and sick birds. I will tell you later in my topic. So next thing is how we are going to collect samples. So basic things, the thing is how to collect a sample from a sick bird or a healthy bird, and whether the collection of samples is needed or not. So thing is what are the samples we are going to collect from a bird? It's a oral swab, voinal swab, and we are going to collect blood samples from a sick bird, cloacal swab, fecal material, and further and skin scraping based upon the clinical sign and kind of disease which we are going to diagnose. We are going to collect the sample. In case of oral swab, most of the time the pet birds come with a thing of inappetence. So we have to examine orally. So when we examine orally, we can see some slimy material over the tongue. We can see some ulcer. We can see some cheesy materials around the oral cavity and the upper jaw. So we have to collect that swab. So that is very important thing. So we have to use sterile buds for collecting the oral swab. So this give a clear idea about few diseases like candidiasis, aspergillosis, and Pseudomonas bacterial infection. So the collection of swab, oral swab will give very good idea about what kind of disease we are going to diagnose. And the choanal swab, this is no, it's an upper jaw. There will be a slit-like thing in the upper jaw. So there we can notice some clear straight papillae. In healthy bird, the papilla is very much evident, and in sick bird, it will be blunt. Mostly in case of hypovitaminosis A, the papilla will be blunt or will be absent. And there is choanal area is the area where we can collect this samples for virological studies and some respiratory bacterial studies. So choanal swab is very important, and blood we have to collect. Basically, we should collect blood from basilic vein or wing vein, and you should be very careful in collecting a blood sample, because when you puncture through and through, and hematoma formation is very common in birds, and which will lead to wing drop. So we have to very careful in collecting the blood sample. So this is blood is collected for total CBC and biochemistry, which will give a very good idea about what kind of infection it is. And cloacal swab, we can collect this sterile swab. With the sterile swab, we can insert it in the cloaca and we can collect the sample. This is very helpful in diagnosing coccidiosis, Amelia, Isospora oocytes. So that is very important in collecting these diagnosing these diseases. And fresh fecal material is used to collect, and we can collect fresh fecal material either from the base of the cage, or we can also collect ask the owner to collect and give it to us. And by flotation technique, we can also diagnose some coccidiosis, chlamydiosis, giardiasis. So fecal materials also given fair idea about what kind of disease it is. And feathers and skin scraping. Feather will give a very good idea about what kind of ectoparasites it has. So yeah, healthy feather shows the healthy status of the pet bird. So feather is very important in collecting the sample. And skin scraping also done to diagnose some mites like scaly mite, red mite. So skin scraping also can be done. So these are the samples which can be collected from a bird for diagnosing the diseases. So these are the EDTA sample and collecting tubes for the feces. So see the point where I am collecting the blood. So when you are collecting the blood, you should slightly bend the syringe, so that when you insert the syringe, it should glide over the basilic vein. It should not go through and through. So it is very much important in collecting the blood. You can also collect blood from metatarsal vein, but common site for collecting blood is wing vein. You can also collect blood from jugular vein also. So now, what are the diagnostic methods which we are going to follow in disease diagnosis? So fecal materials is collected, and we are going to use flotation method. And culture studies for mostly we are doing it for fungal studies like aspergillosis, candidiasis. Oral swabs can be sent for culture studies to diagnose fungal diseases and also some bacterial diseases. ABST from the discharges, whatever we get from our sick bird, we can send it for antibiotic sensitivity test, and we can cut short the best antibiotic for treating the bird. And ELISA is screening test to detect the antigen and antibody. In a bigger forms, we try with ELISA. And PCR, DNA sexing. PCR is the method to diagnose the sex of the birds. It is a chromosomal method of diagnosing the sex of the bird. ZW chromosome indicates it's a female. ZZ will indicate it is a male. And skin scraping, it is as I said, skin scraping is done to diagnose some mites like red mite, scaly mite, Nematococcus mite. So that is very common in budgies. So we can do skin scraping, and feather examination is very important because we can see some. As I said, healthy feathers shows the status of health status of the bird. So feather examination is done to look up some feather lice, like many feather lices are there. So you can also examine for the shaft. We can also examine for the broken feathers, and also from ectoplasm. With a microscope, we can see the lice in the feathers. So this feather examination we have done when the patient comes with the constant history of itching and feather pecking. So feather examination will give a clear idea about what kind of infection is having on the feathers. So now we have reached the last part of our thing is treatment. So how we are going to treat the bird? Whether we are going to give oral medication or intramuscular injection, intravenous injection, or we are going to do fluid therapy or inhalation therapy. The choice of medication depends upon the kind of disease and the kind of health status of the bird. See, now here is a point we should differentiate how to differentiate a sick bird and a healthy bird. See, the sick bird is there is a condition called standstill. So when you touch the bird, it will not move; it will stand still, and you can see the fluffy feathers in the sick birds. So the mostly the sick birds will be hypothermic. So in order to retain the temperature, the animal the bird doesn't want to move. So when you see a sick bird, it will not move, and it will have some droopy head, droopy eyes, and we can also see some discharges around the nostrils and vent pasting. These are the clear signs of sick bird, and you have to grade the bird whether it is highly sick or moderate sick or healthy. So you have to grade accordingly the kind of clinical sign it is going to exhibit. So now here, what are the kind of medication we are going to go? See, oral medication. See, most of the antibiotics we prescribe, we will ask the owner to give oral medication. It is by saying it is very easy to give an oral medication, but the thing is, it is a toughest topic of giving a medicine to a bird. See, aspiration pneumonia is very common in birds. Once you give very forcefully the medication, then the animal medications will go to the trachea, and immediately that aspiration effects will start, and sometimes it becomes very fatal. So we have to give very slow and steady medication, and we have to rule out before how we are going to hold the bird. For holding the bird for oral medication is very important. And second one is intramuscular injection. Never ever try intramuscular injection on thigh area. See, anatomically, the renal portal system in birds is in such a way, whatever the drug which are going to inject on the thigh area, it is going to give nephrotoxicity to the bird. So sometimes when you give, it is highly fatal, and you can see the result in the table itself. So never ever try intramuscular injection in the thigh. So predilection, the good site for giving an intramuscular injection is brisket area near the keel bone. So brisket area or chest area is the right place where we can give intramuscular injection. So mostly we use insulin syringe to give injection, and you can try with 1 ml syringe also with the 24 or 26 gauge needle. The issue is that what is the quantum of medicine we are going to inject on a bird? That is very important. See, for a larger size bird, we can go up to 0.5 ml, 0.5 ml. That too, we can divide it into two doses, and we can give as an intramuscular injection. And for a medium-sized bird, the maximum dose of or quantum of medicine which we can give is 0.3 to 0.4. 0.4. And smaller size birds like cockatiel, some smaller birds we can kanur we can give up to zero point 0.3 maximum quantum dose. And for small, very small breeds we can go up to 0.05 like budgies. So this is very very important. And when you want to give zero point 0.5, you can divide it into two parts or three parts, and you can give intramuscular injection. Never ever try the whole quantum at single site. And the thing is, main thing is, they will get hematoma, or they get infection on the site of injection, and it will be more painful. So you have to divide the doses. Third thing is intravenous injection. We can try medium metatarsal vein or wing vein for giving intravenous injections. And fluid therapy here, it is a bolus shot. Actually, warm Ringer's lactate can be given as a bolus shot, mostly in the inguinal area of the bird. So warm Ringer's lactate can be given. It's like giving a subcutaneous dose near the inguinal area, and you can give as a bolus shot. See, the doses for giving a fluid therapy is 0.05 ml per gram per day. I repeat, it is 0.05 ml per gram per day. This is the total bolus shot as a given as a fluid therapy to the birds. And final thing is inhalation therapy. This inhalation therapy is given as an aerosol therapy. As I showed you the chamber in which we can give. We should have some nebulization unit wherein we can use some antibiotic rescues for any respiratory related diseases, and where bird is too sick, where the oral medication or intramuscular injection is not possible, we can try inhalation therapy. Inhalation therapy is now it's a very good therapy, and for birds I say, because very easy to handle, and it is give very good results by inhalation therapy. So now we are going to the second part of our basics. It's restraining procedures. The very very important thing in birds and avian practice is how we are going to restrain a bird. See, in our normal practice in dogs and cats, we know how to. We put a muzzle. We ask the owner to handle the dog and cat. We put in a cage, and very restraining procedures are there in dogs and cats and other animals. But in case of birds, we should be very clear enough how we are going to restrain a bird. So first thing is necessity, whether we have to restrain a bird or not. Mere seeing the bird is enough to diagnose the any disease. That is very important. No, don't need to restrain a bird and then diagnose it. First, you see the bird, watch the bird, then you think of on yourself whether you have to restrain a bird or not. And species wise consideration, see, the handling a bigger bird is different from handling a medium sized bird than small sized bird. So species wise you have to consider, but see, handling a macaw is very difficult. When it bites, it is very severe bite. And when you want to handle a medium sized bird, that is okay, we can handle with the bare hand. And small sized bird also, it's okay. But how we are going to handle a bird, that is very very important. Species wise considerations very very important in restraining a pet bird. Environmental safety, see, when a bird comes to a clinic, immediately you never examine your pet bird. See, tachycardia will be set when the bird is brought to our clinic. The high heart rate will be there. Immediately when you examine, the bird will be under a lot of stress. So you should know how to handle a bird. You should not handle immediately. You should take some time. Let the client wait for 15 to 20 minutes. Let the bird become accustomed to the environment, and you should be the room should be soundproof, and see to it no other animals should be near the bird. and you should switch off the fans in case of if it is a free flight bird. So environmental safety is very very important in restraining a bird. And handling methodology. See now how you are going to handle, whether you are going to handle a sick bird or whether you are going to handle a healthy bird. See, handling a sick bird is very very different from handling a healthy bird. See, for which you should know how to differentiate between the sick bird. As I said, you have to differentiate sick bird and a healthy bird. The sick bird, see, the problem is that when you handle a sick bird, it should be very, very soft way. And you should see whether how you are going to, what methodology you are going to handle a sick bird. Normally, we try with the towel. Towel handling is the normal method of handling the sick bird. But healthy bird also same way we are going to handle. Never ever use tough gloves or like leather gloves, because even minor changes in the sick bird we should not sensitize it. So when you handle with tough gloves like leather gloves, sometimes it might become very fatal when you handle a sick bird. So handling methodology is very very important. You keep all the necessary equipment for handling nearby and you just start handling. Most of the time, birds we come for feather clipping and nail clipping, and the bird will be very healthy. In those cases, we can use isoflurane anesthesia, and it is one of the easiest method of restraining a bird, for which you should have some boils apparatus with vein circuit. And nowadays, a lot of wall mount boils apparatus are available. You can use isoflurane anesthesia to handle this to restrain the birds. And soft and firm handling is very very important, because when you hold the bird very tight it might die, and when you hold the bird loose it might fly. So it is on your hand, and this is a kind of skill how you develop when you are seeing a lot of birds day to day. So this is very very important, soft and firm handling. And wild and tamed birds, see wild birds it's very very hard to handle rather than the tamed birds. And whenever the owner brings the bird, then you have to ask whether it's a wild or tamed, because wild birds, which is very very high task for us to handle and treat the birds. And for tamed birds, it is easy. They can come into the perch or they will come into the hand, and we can easily examine the bird and then we can treat also. So you should have a fair idea of wild and tame. Usually the breeding pairs. When the owner brings the bird in a pair, the mostly they will be wild. They are not tamed. When the bird is a pet bird, when they grow as a single bird and at house, it will be mostly tamed. So you should have a fair idea about whether it's a wild or tamed bird. So this is a towel handling method, wherein see how we are holding the bird. See the both little finger and thumb finger, you have to hold the bird, and it should be firm, and it should be very soft. When you crush that neck area, sometimes it becomes very fatal. Before handling also, you should know how to handle a sick bird and a healthy bird. This is the isoflurane anesthesia. See different types of induction mask available for different varieties of birds. It's available in market, and it is very very easiest method of restraining a pet bird. And now we are commonly using this method to restrain a bird, and mostly this restraining is done only for feather clipping and nail clipping, because bigger birds won't allow easily to cut the nails and trim the feathers. This is a case how see how we are handling a bird. This is a case of egg binding, where we are removing the bird egg from the abdominal area. See here we should hold the bird very very gentle, because when you hold tight, we will be trying pushing the egg out, but we will hold the neck very tight, and that becomes very fatal to the bird. So this is a budgie. So you should know how to handle a bird soft and firm. So here in the case of egg binding, what you have to do, you have to hold the egg and you can use some lubricants around the vent area, gently press the egg. You should take a lot of time, because it is not the easiest thing to remove the bird egg very easily. It will take a lot of time. The point which I am trying to say is it's handling. How you are going to handle the bird. So soft and firm handling is very important. Now how we are handling an anesthetic. Keep the bird upright position and give a gentle massage on the breast area so that the animal will revive faster after from the anesthesia. So this is the way how we keep the anesthetized bird. So now we have restrained a bird for X-ray procedure. See how we have restrained. This bird is under the influence of isoflurane anesthesia, and we have taped the head and leg so that cross area is it should be exactly on the keel bone, so that all internal organs are very clearly we can have a clear picture for diagnosing the disease. So once the bird is turned left or right, and the keel bone will move towards one side, and that will not give a clear picture for diagnosis. So this is the right method of diagnosis. So after restraining, how we are going to clinically to examine the bird. So clinical examination of the bird, each and every part of the bird will give a fair idea of diagnosing a diseases. So it is very important how we are going to diagnose clinically by topographical examination. Well, then we for a topographical examination we start from the head to the feathers. So now we are going to examine the head. So many cases in our clinical practice, many cases come with head trauma because they would have not clipped the feathers. The bird will, unfortunately, they will fly, they will hit by the fan, and we will get lot of cases, trauma cases of the head. So we have to watch out any trauma in the head, and we have to see feather loss in the head region. Feather loss sometimes may be physiological and sometimes pathological. Physiological feather loss, baldness is noticed in some cockatiels, and pathological baldness is due to some mites and some ectoparasitic infestation. And we have to watch out any swelling or hematoma in the head region because due to the trauma. And head tilting and dragging of the head is very common in paramyxovirus group of infection. That too, it is highly noticed in pigeons. And when you see torticollis in any bird, the diagnosis is poor to great. You can tell the owner it is impossible because torticollis is mostly irreversible. And see the trauma of the neck regions, and we can see some wart-like growth in the buccal commissure. Sometimes you can see some growth in the box-like lesions in the vertebra and any trauma of the vertebra. You can also notice many things on the head regions. And eyes, so eyes will give a clear picture about you have to watch out for any discharge, any trauma of the eye, any scales or crust around the eyes. Even the scaly mite, we can see lot of scales and crust. The term is called scaly mite in Nemodocoptus mites. It's very common in cocktails and budgies. And any changes in the orbit, any swelling of the eyes, you have to notice. And you have to see the cloudiness of the third eyelid, and sometimes we can also see some prolapses. So these are the things noticed in the eyes. See the diphtheritic lesion in the eyes, cloudiness of the eyes. So cryptoctomus, this is cryptoctomus of the eyes mainly due to the chlamydial infection, and it is seen mostly in cockatiels. Many pet owners come with this kind of infection to our clinic, and it is mainly due to the chlamydial infection. You can see watch out the cataract in the eyes. So beak and serrae. It's first you have to look out for the shape of the beak. So overgrown beak is very common in cetacean group because of the poor perch and because of the poor feeding behavior of a bird. So the overgrown beak will lead to unable to eat the seeds. So we have seen many cases of overgrown beak. We can trim the beak and we can shape the beak, but we have to see the vascular and avascular area of the beak. That's very, very important. So first you have to see the watch out the normal shape of the beak, and you have to compare how it is abnormal. So, and the trauma of the beak is very common due to the head injuries, and we should see the size of the beak. It's either it's overgrown or a malformed beak, and sometimes we can see some congenital deformities of the beak. Keratinization around beak is very, very common in African grey parrot, because we have improper perch. When the perch is not available, the bird is unable to do the rubbing process. So constant rubbing only will help in to avoid hyperkeratinization. So you have to watch out the perch. Keratinization, hyperkeratinization is very common in African grey parrots, and you have to look out for the cirri of the beak. That's a fleshy part around the nostrils. You have to see any trauma, any break in the cirri, or any infection. You have to watch out. So this is beak area will give a fair idea about the any trauma or see the bird mostly will not will have inappetence because of the poor beak or a malformed beak or a misshapen beak. See here the budget. This is called a scaly mite with a nebulocoptic mange. See the beak. See the structure of the beak. It is malformed. And budget is with overgrown beak. So here we can use some nail trimmers, and we have some trimmers to trim the overgrown beak. And many times we'll get cases of overgrown beak. But the thing is very, very important is you have to differentiate between the vascular and avascular. When you touch the vascular area, when you trim, it is highly fatal. They will have a pain shock. So you should trim only the avascular area of the beak. See this is an injury and the beak with the trauma. So upper beak has gone. And PBFT of a cockatoo. This is a polyoma virus disease, and this is very seen in highly seen in macaws. So all feathers will shut down. It's a chronic disease. Mostly it is untreatable, and they become naked without feathers. And you can also see in budgies. Budgie it is called French moot. See, this is a traumatic avulsion of the mandible due to the head injury. And so here you have to watch out the ears of the birds. Ears are located slightly lateral to the beak, and you have to lift the feathers, and you can see a round opening. So you should watch out for the discharge in the ears. You have to watch out for any growth in the ears, and look out for any parasites, lice, mites around the ears. And you can also check some blockade in the ear canal. Otitis is very common in birds which have a habit of, they keep the water in the bowl, and the bird will take bath in the bowl. But during those times, water might enter into the ear canal, and they have the chances of otitis. So this is a case of otitis externa. So body of the bird is very, very important. Around 70% of the diseases or any signs we can notice by examining the body. You should watch out neck, thorax and abdomen. In usually you have to, while examining the body, you should examine the crop area. Many cases in our practice will come with this feeding tube. When you examine a crop, there will be a feeding tube, because while feeding the young chicks, they will take the feeding tube inside the crop. And while palpating the crop, you can see the feeding tube inside. So we can remove manually or we can remove surgically. So you have to examine the crop. Crop gives a very good idea about how the bird is. Mostly the bird comes with sore crop, And sometimes crop burns are very common. So crop burn, where they when the owner feeds the chick with a very hot infant formula, so the crop will have injuries, burn injuries. So you have to watch out the crop for burn any burn injuries or foreign bodies. And feather pattern and loss. You have to check the feather pattern because the feather pattern clearly gives indication of the health status of the bird. If it is a broken feather or any feathers with less number of feathers or shedding of feathers or molting of feathers, will give an idea that it has some problem within the body or some parasitic infestation. So we have to see the feather pattern and loss, and check for any growth, abscess, cyst or tumor, quite common in birds. So you have to watch out for any growth, and check for any fracture of the keel bone. So whenever the bird fly inside the house and they will hit in the door and other things, the bird will unable to stand. You have to watch out, and you have to palpate the keel bone and to check any fracture of the keel bone, and check for the muscle wasting around the. This is very very important. 50% of the clinical cases will come with muscle wasting disease. This is nothing but when you examine the breast muscle, there will be muscle wasting will be there, and we can see a predominant heel bone. So this is muscle wasting disease is a composite disease like as bacteria, virus, fungus, many causative organisms will cause this muscle wasting disease. So once you notice a bird with wasted muscle wasting around the keel bone, then it is a clear indicator of sick bird. It's a clear indicator. So whenever you want to say a bird is sick, just palpate the breast muscle. If the muscle is wasted around the heel bone, it is called a sick bird. So there are various methods to diagnose, as I said, to go for all kind of examinations to diagnose what has caused this kind of muscle wasting. Mostly the inhibitus will cause muscle wasting, and you have to, and that is a chronic illness. And what is the causative agent for causing this inhibitions? For that, you have to rule out. For that, you have to examine orally, and you look out for the many things like HEC materials, slimy material, and send for take some swabs, send for diagnosis. After that, you have to treat. So check the muscle wasting around the key one. This is 50% of the clinical cases will come with this kind of muscle wasting this problem. This is a lorikeet parallelism that this bird has a muscle wasting problem issues, and see the necrosis of the pectoral muscles due to trauma, and see the crop injury. Here see, due to the crop burn, the total crop has got open, and nearly most of the infant chicks like cockatiels, canoes, and like cocker parrots, they will bring chicks with the crop burn injury because the owner doesn't know how much temperature to keep. Sometimes they will feed very very warm infant formula. In those cases, we will get crop injury. Sometimes the owner will not feed infant formula with the warm water, with the cold water, and that will leads to sore crop. So both the sides will get some problem, either sore crop or crop burn. So you have to diagnose accordingly. So wings, most of the time trauma of the wing we will get, and clearly we can see a wing drop in those cases, and we will see a fracture of bones inside the wings. So in clinical examination of wing is very very important. Watch out for the feather damages, any fracture of the wings bones, and propatagium rupture. It's a triangular flap of skin around the wing area, which is helpful in the flying. And the propatagium rupture is very, very common in birds, and that too in raptors. And wing drop, as I said, if there is any trauma in the wing drop will be there. So that is a clear clinical sign which we can see in any wing fracture. and any swelling around the wing. This we can see in some nodular lesion, lifted lesions, and some mites. They will cause the swelling around the wings. So clear palpation of wings will give very good idea about what has happened to the bird. See the wing prick trauma, the trauma which has happened, and the hematoma. Sometimes when we collect the blood, hematoma will be forming, but this is a case of trauma. See the prototypium, this is a triangular flap, just ruptured, and mostly this happens in bigger birds when they get a trauma or hip injury, the prototypium gets ruptured. Legs, watch out for the swelling, watch out for the fractures of the leg, and bumblefoot. Many cases comes with the bumblefoot. So it's a bacterial infection. So the bird unable to walk and they will stand on one leg, which will give clear idea about bumblefoot. We have to palpate the leg which is having bumblefoot, and various bandaging techniques and antibiotics available for bumblefoot. Watch out for the gait. The gait when the bird is standing or unable to stand, there is something problem with the foot. So you can clearly diagnose by palpating and see the gait and necrosis of the digits. It's common in birds which is caged. So most of the parrots will get stuck with the cage and they will fracture the digits. Once it is left undiagnosed, then necrosis will happen. So clearly palpate the digits. So this is a macaw with injured digit. This happened with the hair, which is wound around the neck, and they have left unnoticed. So they become swollen. We have amputated it. This is the case that Kanur, which is having a fractured leg. See the necrosis of the leg, and we have also amputated that necrosis part. And this is a congenital conformal subclass. This is a congenital disease in dogs, but it's and pododermatitis or bumblefoot. See the floor of the foot becomes very rough, and sometimes it gets swollen, and sometimes we can see some ulcers, sometimes we can see some fissure. So we should bandage the bird and with some antibiotics and cleansing with antiseptics. Nails, you have to watch out the nails for abnormalities, any breaks or bleeding or overgrowth, any infection of the nails, and many times due to the improper caging, avulsion of the nail is also very common. Mostly pet owners bring the healthy bird for trimming the nails. So you should be very careful in trimming the birds. But here the avascular is very difficult to differentiate. So you should be very careful. We use isoflurane anesthesia to trim the nails, and it is quite easiest to trim the thing. We never cut the nails. We always trim the nails. This is a congenital problem. See the necrosis of the digit due to the improper caging. And skin and feathers. See, mostly we have to watch out skin and feathers for ectoparasites. Many times feather pecking is very common in birds. You should know which is physiological or something which is normal or something which is pathological. See, when you keep same-sex birds in a cage, then they will automatically go for feather pecking. They will fight and they do feather pecking. And higher varieties of birds like macaws and cockatoos, there is a boredom. There is a condition called boredom in birds. When you don't keep toys, when you don't give concentration, or when you don't play with your pet parrots, so they become irritated and they pluck all hairs, feathers from the body. This is called feather pecking, and mostly because due to the boredom issues. This is psychological issue. Third thing, some deficiency of trace minerals, feather pecking is quite common. So you always watch the uniformity of the feathers. Uniformity of the feathers is very important because Healthy birds will have uniform, beautiful feathers, and sick birds will have broken feathers and they have irregular feathers. So, by seeing the bird, seeing the uniformity of the feathers, we can see the health status of the bird. Watch out for any external parasites like feather lice, and many ectoparasites are available. And I have seen some ticks on the birds which have both cats and dogs in their home, and some birds even pick some ticks from the other pets. To see for the broken and misshapen wings, tail feathers, sometimes they will fall. Generally, molting also will happen. That is physiological. Sometimes they pluck the feathers, and you should clearly ask the history from the owner about how it has happened. So we have to see, you have to get the clear history regarding the feathers. So baldness, as I said, physiological baldness is also there in cockatiels. Pathological baldness we can see in PBFT, citizen beak and feather disease. It's a chronic disease wherein all feathers will fall down and the bird looks naked. And in budgies it is called uh, French mood, where the bird looks naked without feathers. So mostly we take skin scraping on the scales and crust, and you can watch out mites, red mites, and scaly mites. Mostly Pneumococcus mites you can notice on the on this scaly material. See, this is the Pneumococcus infestation where the scales are crust are noticed around the cerrae and the beak. So we can take the scraping and we can watch under the microscope. We will see the Pneumococcus mites and see the nodular lesion caused by the mites. And this is a baldness caused by the epithelial lymphosarcoma. This is quite common in budgies. And you can see the baldness and feather will fall on the infected areas. And self-mutilation. This is what I said about the boredom. When the bird becomes very bored and they feel alone or the attention seeking will be there. And if you are not giving much attention to your bird, then they will self-mutilate and they will pluck all the feathers. Self-mutilation also may be due to parasites. So sometimes physiological, sometimes pathological. Baldness due to self-mutilation. It's a caged bird wherein when both sex, same sex, at the single cage. So say either it will be male or female, they will fight with each other and the feather plucking will be there. And sometimes they also self-mutilate. And see, this is due to the cage mites. Feather pecking due to cage. And see the feathers, it is having a lot of feather losses. Excuse me. Sometimes red mites and diphtheria mites, Nemdococcus mite, Germanis carina. So these are some mites. We'll saw some lice we can see on the feathers. They will be moving around. By there, they keeping the feathers on the microscope. You can visually see those lice. Preen gland or oil gland. So preening is very commonly noticed in all birds. Preening is nothing but distributing the oil gland from the preen. It's a sebaceous gland, and it will uniformly distribute among the birds. Sorry, feathers. So to make the feather healthy, and it is make some it is highly useful in water birds, but in also in exotic pet birds, it is feeding is it's very common. You should not confuse with itching, constant itching. Some owners will say, "Sir, my bird is constantly itching," but that will be a preening activity. So preening is very common in some exotic pet birds. This is only absent in Amazon parrots. So this is a base of it is located on the base of the tail. It's a bilobed gland. You can express some secretion for the sebaceous gland, and you have to watch out for any trauma or bleeding of the preen gland. And as I said, it is highly useful to keep the birds healthy for this. This is absent in Muslim rats. See the infection of the queen gland. Thank you very much. I hope this gives some good idea about of the basics of the avian practice. And thank you, Ashita. Hello.
Yes, sir. Thank you so much, sir. Thank you, Dr. Stalin, for this splendid presentation. It was most engaging. We will now open the floor for the Q&A session.
Okay.
Mainly, there are there's only one question that has come, sir, that they want to know sex differentiation. So, could you please explain elaborately how you identify the sex of a bird?
See, the thing is, sex differentiation is only for the monomorphic birds, wherein we cannot differentiate the male and female. In our practice, what we do, we will take a feather and we will send it to a lab. So there, they will have a technique of PCR method of diagnosing sexing. See, when the chromosome is ZW, it is female, and the chromosome is ZZ. This chromosomal identification is done only by PCR method. So for which we can send only the feather. Even the feather, if you send it to the lab, they do the chromosomal identification by PCR method, and they will tell you whether it's a female or not.
Okay. Thank you, sir.
Thank you.
On behalf of On behalf of the Veterinary Association of India, I extend our heartfelt gratitude to Dr. S. Stalin Velladurai for being an esteemed speaker at the National Online Symposium on Exotic Veterinary Practice. We sincerely appreciate the time and effort you dedicated to sharing your knowledge with us, sir. And your insightful session has enlightened and provided our participants with valuable knowledge. It was like, a mini session of avians, and it was really amazing. Thank you, sir, for your invaluable contribution and your time. We look forward to having more sessions with you.
Thank you so much. Thank you so much.
Okay. Okay.
Ma'am, I'll introduce you, and then I think
Sorry?
you can start your. I'll introduce you, and then you can start your presentation.
Sure, sure. Okay.
Good evening, everybody. Today we are joined by Dr. Rina Dev. She's a leading voice in Indian veterinary medicine with over 12 years of expertise. She's an alumni of Apollo College of Veterinary Medicine and Bombay Veterinary College. She has built a reputation for excellence that goes beyond traditional pet care. Dr. Rina Dev is one of the few experts in the country specializing in exotic animal care, providing life saving medical and surgical interventions for birds, reptiles, and small animals. Her clinic is a sanctuary where cutting edge science meets a deep rooted passion for wildlife rehabilitation and domestic pet wellness. She has won multiple awards for her works of conservation and animal welfare. We are glad to have you here, Rina ma'am. Over to you.
Hi, thank you for having me for this lecture. Though I can't see anybody, I can't even see my own self on the screen because I'm very bad with computers. In between work, I've asked somebody to organize this for me. So, the previous slide, Dr. Stalin did something related to birds. So, I just thought I'll do an overview more with turtles and snakes because when we talk about exotics, it's not only about birds, it's turtles, snakes, hedgehogs, you name it, everything. And the deeper you get into this subject, the more complex you realize how it is, and you also realize how challenging it is. So, I'm just going to share with you a few cases that if you are curious about exotics, these are some common cases when it comes to reptiles that you might encounter in your practice. So, the simplest thing to start with is with your turtles, okay? So, understand with exotics, whether it's birds, it's turtles, it's anything, most of your issues are related to deficiencies, and then whatever you're seeing post deficiencies, your bacterial infection, viral infection, anything that you're seeing, your metabolic diseases and all, there is always a nutritional component to it. So thumb rule is, I always tell people, when you're treating any infection, make sure that you are doing supportive treatment. When we talk about supportive treatment, we talk about basically that making sure the animal is nutritionally sound. So turtles, your number one thing is vitamin A deficiency, calcium deficiencies. You see a lot of respiratory tract infections, shell infections, and reproductive diseases. Okay, why vitamin A deficiency? The first and foremost thing with any exotic that's coming into your practice is not only doing a physical exam but also understanding the history of the animal. When I say history of the animal, it means right from how the animal is being kept, what are they feeding the animal, where did they procure the animal from. These are very, very important factors. So, say if somebody even said that, oh, we are giving the turtle, we are giving him pellets, we are giving prawns, we are giving, whatever, we are giving chicken. Sometimes you just need to understand whether how long are they doing it from, or is it something that they just realized and they started recently, or they've been doing it from the beginning. Because sometimes it's not magic, it's because all your deficiency things are going to happen over a period of time, so it's not going to get cured also immediately. Why vitamin A deficiency? Most of the diets will be wrong. I've seen people maintain red eared sliders just on coriander and tomato. Sometimes a lot of your turtle food also is deficient in it. So simple signs like, oh, the animal may not be eating, there may be lethargy, swelling of the eyelids, swelling of the ears. You might see, and ear abscess and oral abscess, which is extremely common as a clinical case that will come to you. And yes, your secondary respiratory tract infections, because your vitamin A helps to maintain integrity of your mucous membrane of your respiratory tract and all of that. So yes, deficiencies will lead to secondary infections. Now, how do you treat this? If I am seeing any animal come at me, with eye swollen or an abscess or anything, I will first chalk out a line of treatment in terms of diet. Diet is one thing you will improve on. So you will make sure the animal is getting the right diet, the right supplements. When there is deficiency, merely by just adding supplements is not going to help. A lot of time you might need to do injectables, keeping in mind that most of them will be nutritionally deficient. You get vitamin ADK as a supplement injectable, which does help. There is a protocol to follow. It's one injection every alternate day for a week, or you might, depending on how severe the deficiency is, you might need to do one injection per week. Sometimes it becomes a challenge because of a lot of clients stay really far off and they may not be very open to coming every alternate day. You do get oral supplements also like aquasol that you can add, but nevertheless, injectables, if you're looking at deficiencies, is what is going to help. Secondly, what you're going to use is antibiotics for your infection. So remember, no treatment will be complete unless you add your supplements for it. Most common antibiotics that are used in reptiles is enrofloxacin. But unfortunately, because we are doing so much of testing and doing cultures and all, because a lot of them are immunocompromised, we've seen that in most of these cases, they are resistant to enrofloxacin. So sometimes enrofloxacin just might not be your drug of choice. And if you're able to do a culture, the owner is able to afford one, definitely look at doing cultures. These are some of the foods that are low in vitamin A, okay, which I've put to the list. So you can have a look at them and also see whether the owners are incorporating any of these in the animal's diet. I would generally, if it's an animal that eats non-vegetarian also, I would put them on a diet where there is some amount of animal organ also involved, like chicken liver, chicken heart. These are organs which will also help to take care of deficiencies. Adding some amount of bloodworms also helps. You can add prawns also to their diet. This is specifically when I'm talking about red-eared sliders or any of the turtles which are non-vegetarian in general. So ear abscess. Now, these things can be done under local anesthesia, which means you don't need to have the animal completely sedated. What you can do is you can locally apply lignocaine to the oral abscess area, incise it, and the pus that is over there with them is generally it's more cheesy, hard, consolidated mass. Remember, when you're doing this post the incision and you get the pus out, the animal cannot go back to water. So you have to make sure that a provision is done with the animal, because it becomes little challenging, because a lot of times these turtles will not eat out of water. In that case, you can put the animal in some amount of water just up to the lower part of the shell, so that the animal still has the feel of being in water. But yes, you have to be careful about the infection, about there being excessive discharge or it getting further infected, because these kind of abscesses are not sutured. You have to do a daily dressing for the abscess. The other option, if it's a bigger tortoise or turtle and if you need to sedate, you can do a sedation. You can use a combination of drugs. You can use ketamine, midazolam, propofol as a combination with butorphanol. And then that involves a full sedation. So when most vets, it's not more about the vet, it's more about the owner also being comfortable about, sedating the animal. So what I would say, when there are small procedures which can be managed by, locally, giving some amount of anesthesia, then do it under local, because definitely with turtles, reptiles, they take really long to come out of anesthesia also. So whenever we are operating, the other thing that happens for us is your surgery may be for 45 minutes, but the animal totally coming out of anesthesia sometimes may even be up to 24 hours. So these are things you need to keep in mind when you're making decisions in terms of what approach you want to have towards a particular case. These are pretty much the drugs that I mentioned. Enrofloxacin, 5 mg per kg. I would suggest a lot of times it's better if you look at diluting the drug. Vitamin A, especially for hypovitaminosis, my take is out of 10 cases, probably all of them are deficient. So I will always make sure I, do an additional pep up with vitamin ADEK for them. Metrogyl works well. Fluconazole if we are suspecting any fungal infection. What you can also do, this caseous matter that comes out, if you can do cytologies, because that's something I firmly believe in, that to, for us to understand the case more and be better equipped to treat and understand how bad the infection is, we should do cytologies ourselves. Why do it ourselves? I've also seen a lot of times where I have seen a slide and I've sent the sample out for a culture, it comes negative for bacteria. And that's when I speak to the microbiologist and I'm like, this is what I have seen. So a lot of times they don't have an answer to it, or the animal's already under treatment. That's why it doesn't show up. So I feel for us to learn, the best is to see these slides ourselves. Painkillers, you can use meloxicam, butorphanol. Eye drops like prednisolone can be used if there's excessive pain with the eye, when the eyes are swollen. But just make sure there's no eye ulcer. Gatifloxacin works well. Tobramycin also works pretty well with them. Metabolic bone diseases. Now, I think out of 10 cases, 9 of them have MBD, metabolic bone disease. It's just the severity of it differs from case to case, because no matter what we do, I think keeping reptiles is extremely, extremely challenging, especially when most of us live in an indoor environment, like most of your cities have flats. If you meet a person who has a garden and they're keeping turtles, tortoises, you can immediately come to know the difference versus somebody who's keeping a turtle or a tortoise indoor. So the amount of vitamin D3 they need, the UV light they need, the calcium they need, for whatever reason, it's extremely difficult to maintain it and give it to them indoors. Now, because of this, you have misshaped bones. A lot of times, the turtle doesn't even look like what it's supposed to look like as a species, as a breed. So take it for granted that that's one thing you have to rule out. And unfortunately, MBD is overlooked. People don't realize it. Whenever the animal comes to you, it's MBD along with something else that the owners come for. So most of the times, even when you're treating the turtle, sometimes you ignore the MBD because it's been there for the entire life of the turtle. When you're treating it, you're going to help it to some point, but it's never ever going to reverse. Causes diets that are low in calcium, high in phosphorus, that is an issue. Insects also have a negative calcium phosphorus ratio. So a lot of times, reptiles, if there are certain insects or more insects that they are fed, that might be a problem. Again, also understand everything that has a picture of the reptile on it and says reptile calcium does not necessarily mean that it is specific for reptiles. I mean, it's very easy to sell it to your client, or it looks very attractive to us also. But trust me, go read the ingredients, see how much is required. If you are somebody who practices exotic medicine, one thing you should have is the exotic animal formulary, right? In the formulary, you will see when you actually are going to be calculating doses. When I'm saying calculating doses, when you're going to do like how much an iguana needs versus a red-eared slider turtle versus a Hermes turtle, the content that is required differs so much. And then you will see it doesn't match any of these calcium supplements that are in the market. I mean, if you have any, especially our local supplements that are there, it will never match. The quantities will be way too high or way too low compared to what is actually being formulated and sold in the market. So be careful about that. That's why I stock very few supplements and I recommend also very few supplements. Second is the improper husbandry practices. Again, your temperature plays a vital role for them. The UVB light plays a vital role for them. You will have people say, yes, we are giving UV light, but they've probably not changed the UV bulb forever. So you need to change the UV bulb every 3 months. Make sure that it's a proper UVB bulb. The distance from the tank or the animal, how many hours in the day it's being given to the animal. If you see in the wild, any of these, even your, aquatic, your turtles, they spend a lot of time basking out in the sun in the day and they will feed in water. So they can spend the entire time out in the sun versus water climbing things like, half an hour of UV light or half an hour of sunlight is okay. No, it's not okay. So that's why I said it's extremely difficult to maintain, and that's why MBD is so extremely common with reptiles. Signs and symptoms: hard knobs and long bones of leg. You will see that, the legs, probably the best thing as a vet for us is first to just do an X-ray. You will see bumps along the vertebral column. Sometimes the jaw may be very hard or very soft. When you hold the turtle itself, if you're able to press it, that itself is not a very great sign. In extreme cases, there may be even twitching and tremors that you might see in the limbs and muscles of the legs. Pliable mandible maxilla, that's extremely common, and that can lead to weak fractures for them not wanting to eat also. Also, a lot of time draggings of limbs while walking, you will see, because they walk on their fours. So the front two, they'll be doing good at, with walking, and that's why the owner won't really bother. But if as a vet you're observing the animal walking, you'll see that the hind limbs, they're actually dragging the hind limbs. Next is obviously reduced mobility and fractures being another thing very common. So I mean, it's important one to convince the owner to start off with an X-ray. My way of telling them is what I do is I said, with dogs and cats, I'm able to manipulate, feel their stomach, look at things. With this, I can't. It's literally like a bowl for me. So the minimum I can do to understand anything that's going on inside is to do an X-ray. When you do an X-ray, it becomes easier to convince the owner also of what is wrong. And obviously, it helps in your diagnosis also, because just superficially giving becomes very difficult to diagnose and makes it very difficult to correlate and make the owner understand things. So there you go. If you see these two, you have so many owners who will say like, नहीं, but वो खाता पीता ठीक से है तो कोई problem नहीं है. But they will not realize that this is not the way the animal has to look or the animal looks like. This is not what the animal looks like in the wild. If you see the shells, they are absolutely malformed. But this animal probably has spent his life eating properly, and only when it's really bad, the owners come and you end up telling the owner something's wrong with it. They're like, we've never had any problem for all these years. The next thing is overgrown beak. So they will come with a complaint of the animal not eating properly. So in those cases, you have to make them understand that the beak is overgrown. You'll probably need to trim it. This can also be due to your imbalance that might be there. Reduce mobility, that I spoke about the hard knobs on the legs. Okay, so if you observe the animal properly, this kind of an animal will probably be dragging his hind legs. There have been instances people have tried to use these Lego wheels, and it's helped the animal. But like I said, a lot of times they come to you when it's already very late. So in these cases, you should look at doing pain management, doing your calcium supplementation. Some amount of glucosamine also will help, but it's a long process. That is something you need to tell the owner, convince the owner that this is not going to get okay overnight. And you obviously your chances to what extent it can get okay is also very questionable. These are just few radiographs to understand, not my radiographs, but I shall use mine next time. But if you see over here in the x-rays, if you see in the x-ray on the left, you'll see how reduced the lung space is because the shell is caving inward, and that's not how it should be. And in the x-ray on the right, if you see that the shell is, tented upward, so the lung space is increased. So both of them are bad in their own way, but to make the owner understand, it becomes so much more easier if you just show them the x-rays and tell them how much lesser lung space the animal has. So it's going to be difficult for the animal to breathe, and it's probably been there for a while. The next thing, because of MBDs, yes, shell fractures is something that you're going to be very prone to. A lot of times we do end up seeing, turtles fall from a height and the shell getting fractured because of that. But also in cases of MBD, you might just end up getting fractured to an extent where the lung also might end up, the airspace will end up getting exposed. Coming to respiratory tract diseases. Signs and symptoms, the most common thing that they'll come to you with, they will talk about that the animal, uske naak se bubbles aa rahe. There'll be decrease in appetite, there'll be difficulty in breathing, there'll probably be mouth breathing. A lot of times there might be a noise also that the turtle might, constantly make while breathing. Also, you'll see that the turtle will not want to get into water. In most lung infections, they do not want to get into the water, they do not want to be in water for a lot of time. They will have a issue of buoyancy is where they are unable to balance themselves, because if there is congestion, there's pneumonia, there's infection in the lungs, depending on the side where the infection is more, they may tilt towards that side. So buoyance is a good way, especially when I work with a lot of sea turtles also. And for me, seeing pneumonia and them is very, very common. In that case, these turtles, how much ever you push them in water, they immediately rise up because they are not able to sink to the bottom because of the congestion in the lungs, the buoyance issue being there. So that becomes an extremely common thing with them. Now, one thing to keep in mind is this is going to be the most common side: eyes swollen, bubbles from the mouth, bubbles from the nose. A lot of times you have to differentiate a respiratory tract infection from a GI tract infection. Why? Because a lot of times I've seen people treating it for a respiratory tract infection, but it's actually a GI tract infection. Now, the only way to diagnose this and differentiate is to run x-rays. A lot of times, if the animal hasn't eaten for a while, if there is any kind of peritonitis, if there is any foreign body causing obstruction, in all these cases, also you will see bubbles from the nose. So make sure that first you diagnose it right. That's why I said x-rays are so important. You can do craniocaudal views, you can do left lateral views and DV views. Okay, DV views will help you with your foreign body. Craniocaudal views will help you to understand if there is a lung infection, and your lateral views will also help you for your lung infection as well as foreign body. Like with turtles, the most common things we see, if I'm not looking at a respiratory tract infection, I will see obstruction, I can see a fecolith, I can see bladder stones, and in females, a lot of times in follicular stasis, we will see these bubbles coming out from the nose pretty frequently because they are so filled with all these follicles that it's constantly putting pressure on their lungs and other organs. So differentiate that and then only treat it. This is an X-ray. This is the craniocaudal view that I spoke to you about. This is a turtle with severe pneumonia. If you look at the X-ray, the right-hand side of the lung is clearer versus the left-hand side where you can see congestion. Now, in this case, the turtle would definitely have a buoyancy issue. One, the turtle will not want to get into water. The turtle, and then these kind of X-rays in most of your sea turtles is extremely common. So even when you are reviewing cases, once you start treatment, you are doing X-rays to understand how much better. Doing bloods all the time will probably not be feasible. So at least use tools which are less invasive and which still give you great enough diagnostics. Respiratory diseases, like I said, so a lot of times, unfortunately, because we don't have very great diagnostics for exotics in India, and even if we do, the cost factor is mostly people who buy exotics don't want to spend on treatment. So I tell people that one to understand as a clinician is irrespective of the cause, you will always anyway start with supportive treatment. Okay, if you are going to like in fact today for a snake I had to rule out viral test, and the viral panel, it was for 2500 each test to rule out the virus, and the whole bill was coming to almost 35,000 when I spoke to the lab, because that many viruses had to rule out, and then it's a hit and miss. You don't know which of these viruses it can be. So a lot of times doing these tests is not feasible, and it's not feasible, your client may not agree. And for me, I will rather, because with exotics, you're always constrained for money and for diagnostics, I will rather put that money on the treatment part. So take it for granted, one, that the animal is anyways coming to you with nutritional deficiency. Whether it's viral or bacterial, yes, I will still do supportive treatment for the animal. If the client is ready to do a culture test, at least, that is great, because you can treat the bacteria or whatever secondary infection that might be there. In virals, we do see a lot of herpes virus, and in bacterials, a lot of Pseudomonas, Mycoplasmosis. So keep all these things in mind and decide your drug of choice. Like I said, antibiotics, enrofloxacin, have not had great results. Margo is what I've been using. Those are high generation. If you need to use antivirals, you can use acyclovir. Again, supportive care, I feel, is your main go-to. Keep in mind, and depending on what you're seeing, if you're seeing congestion, you will use something like N-acetylcysteine with a combination of an antibiotic that you can do for it. This is extremely common. I think in a week we are seeing at least 3 cases of follicular stasis. Why follicular stasis? It's extremely common. Sometimes if these are if these are turtles that are kept alone, or even if they have a companion, these are the pre-ovulatory follicles in the ovary that become enlarged, and that they are not released through ovulation. Now, these follicles can be there. Some cases they are detected after months together, because people only realize when the animal becomes extremely lethargic, doesn't want to move. There may be some nasal discharge. So, follicular stasis is extremely common in females, especially. There will be turtles and tortoises who, for their full life, they haven't never ever laid eggs, or never showed any of these symptoms. But one fine day, after 10 years of age, they have eggs, they have follicles. The way to move forward, unfortunately, in this case, is only surgery. If you don't do surgery, obviously, most of these cases that we've operated, we've always seen secondary peritonitis, there is infection, and eventually, unfortunately, if you don't treat it, the animal does die. And mostly the owner's never going to come to you that it's just happened. So yeah, why it happens, again, incorrect husbandry, maybe some underlying disease, sometimes not enough male contact. But I've also seen with male contact this happening, poor nutrition and signs. Signs, you know what? I feel signs are pretty much the same in all the things. Only the funny part, when we are talking about this follicular stasis, you'll find that the turtle is heavier. Now, if somebody is not eating, not feeling well, the animal should seem lighter in weight. But in this case, when I just carry the turtle, I mean, I'm pretty confident in most cases, like, this is definitely follicular stasis, because the animal feels pretty heavy. Your way to go forward for diagnosis, if you have a sonography machine, yes, you can look at the follicles on the machine. They are pretty much visible. You will be able to see them. For me, I mean, what I prefer doing is I prefer doing a CT scan to see the follicles. Why CT scan? One, the number of follicles, how big the follicles are, how much are they compromising any other organ. It gives you so much of an insight because with these animals, once you are seeing follicles on your CT scan, you know your next step is surgery. So again, I feel with being an exotic vet, we have more to convince the owner, more to prove to the owner. Then if you're a dog and cat vet, so if I'm going to show my client the CT scan versus just telling him, oh, your animal has follicles and this can lead to this can be life threatening. For some reason, I don't think they get convinced, and unfortunately, reptiles don't show you too many emotions for people to really understand. So CT scan is the way to go forward, not only to convince the owner and to understand, but also to plan your surgery, because this will give you an insight into how long your surgery is going to take, how tough it's going to be, and you can also discuss the outcome of the surgery with the owner. Drugs that you do for if there is follicular stasis, sometimes there are follicles along with eggs. So if we are looking at egg binding, we can do calcium supplements, vitamin B, gabapentin for your pain management, meloxicam for pain management, your UV light. Furosemide, we use it because a lot of times there is peritonitis, there's a lot of fluid in the abdomen which makes the animal uncomfortable. Just make sure that you are well hydrating the animal by giving saline, or you're feeding the animal when you're using furosemide. So this is if you didn't have, say, a lot of us might not have access to a USG or a CT scan. Just to give you an insight, if you do an X-ray, one, you will see that if you look at picture 8, that the lung space is reduced. The lung space is the jet black area on top towards the carapace that you can see. And in this case, obviously, there are eggs involved. That's why you can see that there are actually, you can see the outline of the shell. You can also make out that that it's probably deficient in calcium because the outline is pretty faint. So on X-rays, it's more of a hit and miss where you may just see opacity, and if there is an egg, you might end up seeing the outline of the egg. So look out for these things, and for a lot of times when we do the X-ray, we might just see opacity, and then we tell the owner that what, probably we should go in ahead and do a scan because there are very high chances there could be some liver disease, there could be some peritonitis, or I mean, like what we are thinking, that this could be some kind of egg binding and follicular stasis. So this surgery, I mean, yeah, it's pretty common. We are doing it now every week. You can also follow protocol for if there are only eggs. There's a protocol where we use pitocin and calcium injections, hydrate the animal well. Once we've done the protocol, which involves a round of three sets of the same injection, we don't go further and try to induce labor, induce the animal to lay eggs. That's when you opt for surgery. So surgery, in most cases, there are two ways to do it. You can do it through like a pre-femoral method, but honestly, the cases that come to us have been like this for months together. So in most cases, there is peritonitis. There could be chances that it could be attached to another organ. So I am more of the opinion, and I'm more okay with going through the shell with cutting the plastron. That is my approach to it in most cases. Let's talk about iguanas. Again, reptiles, small, whether they are turtles, iguanas, their diseases are pretty similar. Even iguanas, follicular stasis is extremely common. Metabolic diseases, just like what I showed you for turtles, it is also the same with iguanas because of improper calcium phosphorus ratio in their diet. For them also, light plays a major factor. In fact, I think, again, like reptiles, I think iguanas are worse when it comes to metabolic bone diseases, because we reptiles still, I feel some reptile clients come to the vet, but when you're talking about iguanas, there are very few of them that come to the vet. You'll see that they have so many fractures which has already healed over a period of time. So a lot of hairline fractures. If you look at this picture, you could see how the tail is. The other common thing to observe with them is also the pliable jaw and bones, the swollen legs, swollen jaw, leg fractures. So these are things you need to look out for. And like I said, the first thing you need to do is do an X-ray so that it becomes easier for you to understand and also to make the client understand. Lumpy jaw, this is also very, very common because this happens as an inflammatory reaction because there is deficiency in that area. So there's a lot of fibrous tissue. So not only do you have to treat it by supplementing, but you will also need to use antibiotics. Like I said, I prefer doing cytologies, doing cultures for all of this because it's better you do medication that's specific because again, these things are not happened over just 1 2 days. Deviated spine, scoliosis, again, very common. What happens is people may not notice it, like I said, but these are signs as a vet for us to watch out for. The animal may be still moving around, may be still eating, but what is going to happen at some point of time, this is going to end up being a problem for the animal. So it's very important that when you are doing your physical exam, that you make the owner well aware of all of this. They may have come to you for a simple or another problem, but yes, while doing a check, looking at MBD diseases, making them well aware of what you're looking at, what could possibly happen is extremely important. Diagnosis and treatment. Again, like I said, diagnosis is you do your X-rays. So you have a comparison that you can do where you see if you look at the right X-ray, there is thinning that occurs in MBD of the bone versus the left X-ray of a left X-ray which shows the leg of a healthy iguana. Blood analysis. So if you're able to do blood analysis, that works really well because you can look at calcium phosphorus levels. You can explain to the owner about the imbalance that might be there in the levels, and then you need to treat accordingly if there is excess phosphorus, if there's low calcium. Treatment. Now, if there is MPD, if the bones are pliable, and if in a lot of cases you're not able to do fractures, I would suggest doing supportive bandage because one, not every owner, if there is a fracture, not every owner is going to agree to it. One, you will improve on the diet, your UVB light to help synthesis of body D3, fluid therapy, D3 injections, oral calcium supplementations, stabilizing of the fracture using splints is also something that can be done in these cases with the owner being well aware that the prognosis is going to be guarded. This was this iguana with egg dystocia. I mean, I think she was half her weight once we operated her and got the eggs out. With them, again, it is the entire. I mean, it's everything in one, but there is no diaphragm. So everything, the eggs go right up to the heart, which is pretty much like even the tortoises and turtles that we've seen. So yeah, I think this was the weight of the eggs only was I think around one kg. Yeah, so you can just imagine in how much distress the animal would be there. Your causes of egg dystocia are no different than what it is with turtles, tortoises. Your temperature, inadequate nesting sites, your diets, age, physical condition of the animal, injuries, or physical abnormalities in the reproductive tract. Also, constipation if the animal is not very well hydrated, the animal is not feeding. These can be causes. Plus, again, if the egg shape is not proper, which will be because of deficiencies. So, for me, in reptiles, most of the things are happening because of deficiencies. Secondly, sometimes even the enclosures that people keep them in, the animals do need some amount of exercise. If they have a sedentary, the reptiles don't move a lot, but then still, even then, if the enclosures are really small, all these are going to be causes for egg dystocia. Diagnosis and treatment, X-ray, like I spoke about, history, blood tests, you need to start on fluid therapy, calcium therapy. I spoke about the protocol where we use calcium and we use pitocin and fluids. But if none of this is going to work, then definitely surgery is your go-to. Also, make sure when we are using pitocin and all, you have to be careful about how much of it you can use, how many times can you try to induce, because I've seen cases where they've come to me once they've been treated somewhere else, and when we opened up the animal, the uterus is completely ruptured, the egg is out, the yolk is out. So you have to be very careful. If the animal is in inertia, uterine inertia, if the animal is not going to contract, you cannot keep giving these injections. It can be dangerous for the animal. This is the protocol that I was talking about that we use. And if you're lucky, if the animal is able to lay the egg, great. If it's not, then definitely surgery is your go-to in cases like these. Mouth rot, ulcerative stomatitis. This happens a lot of times, a lot of when they are heating while their UV light is closer to the enclosure. A lot of times they even get into fights. We've seen that they get into fights, they may injure themselves, or there's constant rubbing of the mouth on the bars of the cage. Secondary infections, the lamps that I spoke about, poor husbandry, if the cleaning of the cage is not done properly. So this in iguanas, I've seen extremely iguanas or any kind of monitor lizards. This is a very, very common thing that you will end up seeing. Your symptoms will be the animal not eating well, not active, swelling around the jaw. So when there's swelling around the jaw, you will need to differentiate form. Is it some kind of MBD or is it just mouth rot? Skin discoloration might be there. A lot of times salmonella is diagnosed in your culture. What do you do? Obviously, daily cleaning is very important. So, some kind of pain management. We use meloxy, tramadol commonly with them. Taking care using antibiotics. You can even flush the oral cavity. You can use potassium permanganate diluted to clean the oral cavity. You get candid mouth paint also. So, these things can be used, treat it like an oral infection and clean it. And if the animal is unable to eat during that time, nutritional support is definitely important. A lot of times owners also might not be okay if you're going to do saline every day, so try to crop feed. You can use one of those crop needles and try to feed with a syringe. There are ample amount of formulas available now in the market for them, so that is something that can be done, but the process is always very long in these cases. I'm just going to talk about a little bit of skin infections in snakes. I feel keeping snakes is very tough. The humidity, temperature, bedding, substrate plays so much, a very, very important role. Again, the behavior of the snake that makes a huge difference. The most common things, what I did is when we spoke about reptiles, I just categorized it into what I see most commonly in which of the reptiles. That's why it's not like when I spoke about egg binding, mouth rot, MBD, that's also seen in snakes. But yes, species wise, what will come to you more in your practice is what I have kind of focused on and just thought to discuss with you all. Causes of ulcerative dermatitis, scale rot, unhygienic conditions, excessive humidity, moisture, fecal degradation products, inappropriate floor heating. So as I said, and every snake is going to be specific. It doesn't mean that the same temperature is going to be maintained for all. So if you have a consult with a particular species, say a ball python or a rat snake or a bullfrog snake, make sure that you read up a bit on their behavior, how they live, what is their diet. It's very important because your husbandry will possibly differ in all different cases. Signs you may see are necrosis and ulceration of the dermis. There might be discharges, hemorrhages in the skin, a lot of time pustules when it's really bad. These are some of the bacteria that are most commonly we have come across when we've done cultures for these kind of cases. So this is, if you see, this is known as ulcerative dermatitis. So taking samples, giving it for culture is going to help. High humidity or wetness, poor hygiene. These are things that might end up causing this kind of ulcerative dermatitis. Subspectacular abscess. This is also very commonly seen in snakes. This can be caused if the normal shedding cycle snakes, as you know, they generally shed their skin. So if the normal shedding cycle is disrupted, which means that if your husbandry is not poor, your temperature is not proper, the snake might not shed his skin in the way it's supposed to be shed. A lot of malnutrition can also lead to this. So the process is known as ecdysis, that is the periodical process of renewal of the outer layer of the epidermis of the entire skin. So what you see is that the entire thing has to come out, but if the animal is sick, it won't happen. If the animal is not kept at the right temperature, it might not happen. In these cases, what happens is because the layer over the eye is still there, they might form an eye abscess. So in these cases, you might need to surgically drain it, use antibiotics, pain management, eye drops, and do cultures also, because if there's an infection, then you will need to look at treating it. This is how you can even look at aspirating it. Okay, you use a needle to aspirate the exudate that's present over there, or a partial spectaculotomy can also be performed so that there is enough drainage that happens in that area, all the exudate and pus that might be accumulating over there. Abscesses in snakes. So this also we very commonly see sometimes if there are more than one snake in an enclosure, or the substrate's not good enough, if there's been any kind of injury or anything that might cause forming of abscesses. Symptoms are swelling or a mass, trauma to the skin, lethargy, anorexia. How do you diagnose it? One is definitely do an X-ray to see if it's communicating with any internal organ. You might just feel it. Sometimes it can be even if it's a mass and it's not an abscess. Doing an FNAC and is works really well. Look at doing cultures and biopsies. This is one case that we had done, maybe it must be a year old. So if you see the abscess that's there on the left, there is this really swollen area. On the right, there is the X-ray of it. If you see it's not communicating with any of the internal organs, which means we can look at aspirating it, flushing it, treating it locally. The abscess that was there, what we did is we did send it for culture. This is just to show you what it showed. Now, organisms identified he was positive for E. coli. This is your antibiotic sensitivity test, which was pretty good in his case. There were a lot of antibiotics that we could use in this snake's case. Why I like doing it is because a lot of times doing oral medication is also very difficult for them. So looking at putting them on injectables works well for the owner also in most cases. So if with reptiles you can encourage doing a sensitivity, if the owner is good with it, then please go ahead and try to do it. This was regular draining of the abscess. What we did is under local anesthesia, we incised it, we were draining it. If you can see, it's pus filled and blood tinged. And this is what we kept. We kept the pocket open and were regularly dressing the abscess. Okay, so I'm going to end it over here because I think this is the whole point was to give you all an overview of some of the common things that we do see with reptiles. If you do have questions, or I can go on and on because it's such a vast topic. So hopefully this helps you with an insight into reptile medicine. I'm good to stop my lecture over here. So let me know how we go about this now.
Thank you,
Yes.
Dr. Rina. Hi, I'm Bhavna.
Hi.
Hi. Hi. Thank you so much for your presentation. We do have questions, a lot of them. So,
Sure.
and we do have questions for Avian also. I hope
Sure.
that's okay. So, first
Yes,
I'll
yes.
start with Dr. Mohammed has asked, can you explain about sex determination in turtles?
Sex determination in turtles. Okay, so a lot of times for turtles and tortoises, you look at the shell. If there is a curve in the plastron, okay, the plastron, if it's curved, it will be a male because the male has to mount on the female. That's your easiest way of understanding. And in the female, it will be more flat. Now, besides that, obviously, you might see a penis at some point with the animal. So that is your differentiation where the males generally have a tendency to get their penis out at times. So on a physical basis, yes, you will look at the curvature of the shell, and that helps in most cases. Yeah.
Thank you, doctor. Thank you. Next question is by Dr. Meena. She has asked, in daily routine, how much UV light is recommended for reptiles?
Ideally, I would say 8 hours. I would say go by your normal sunlight thing and do at least 8 hours. 8 hours is definite.
Thank you. Dr. Parasaran has asked, can we go for abscess draining in case of hypovitaminosis in turtles appearing in eye?
In the eye, inside the eye or around the eye?
He has not specified, doctor.
Yeah,
He has
because if it's
mentioned.
around the eye, yes, you can. If it's inside the eye, what happens is once you start on antibiotics and all, because the pus it solidifies, you can easily eventually pop it off. So that's why around the eye we commonly see that you can incise and pop it off. That shouldn't be a problem.
Great. Thank you, doctor. Miss Navya has asked, is suturing shell in turtle after incision or surgery a big task?
It is a big task. I mean, I wish I had my pictures to share. We suturing as in like for the shell, we use K wires to fix it together. So you use your dental equipments, the same things that you use for dentistry, the bits, you use that to make holes, and you use K wires to fix it up then after that. Like I have to operate a tortoise now. I think I'm going to take 1 hour just to cut the shell because it's a really big tortoise with follicular stasis.
Dr. Thenamudhan Sivakumar has asked, ma'am, how would you manage the caving in of the shell in MBD of turtle?
So that is what you cannot do anything once it's happened. You can prevent it from becoming worse, and you can do supportive therapy to take care of issues that you're having once the caving in has started. So that's what I said. Shell deformities you are not able to reverse. You can take care of it from becoming worse.
Okay, thank you, doctor. Ms. Navya has also asked, we know the age of snakes by identification method without the history.
I'm not good at this. I'm sure there is a scale thing you can do or something, but no, I'm sorry, I cannot answer this. I'm sure
That's all,
somebody else, if they know, please do answer it.
that's all right, doctor. Then we'll go for the bird questions. Dr.
Yeah.
Kiran has asked, is there any common anesthesia protocol for birds?
Yeah. So the most common is midas, ketamine, butor. You do this. You can use it as a total combination for your anesthesia, or you can use it as a pre-anesthetic and then maintain the animal on isoflurane. So both these combinations work pretty well.
Ms. Ananya has also asked about this. Can there be any other anesthesia that can be used other than isoflurane?
Yeah, midas, ketamine, butor, and with your pain management or meloxicam.
Well, okay, doctor. And Dr. Meena has asked, is deworming in birds necessary?
It's very necessary because see the vaccines that you get in India are all they are meant for poultry. They are not made keeping in mind cetaceans, and we do end up seeing worms because I do a lot of stool sampling. The most common thing that they can get from the fruits and vegetables that they eat are worms. So deworming every 3 months is extremely essential for birds.
Okay, thank you, doctor. Dr. Kamal Raj has asked, please elaborate on feed requirements, the quantity based on body weight and composition for common birds. I think it's a very big question.
We do a whole lecture on nutrition next time. I'll be glad to do it.
Oh, thank you so much, doctor.
I
We'll
think that
definitely take it up.
to elaborate on it, but definitely, I mean, it's so different species wise activity. Whether the bird is sedentary, is it an aviary bird, is it a companion bird? So there's so many things that go into formulating what you're going to give.
Yeah, exactly. And last question is by Dr. Helly.
Hmm.
She has asked proper husbandry for tortoises and snakes, but I think you have covered most of that. Uh, but if you could speak on it a little bit, proper husbandry that should be recommended for tortoises, snakes.
See, for tortoises, you have to have a proper substrate if you're keeping them indoors. So have a good enough big space. You can use cocoa peat. Cocoa peat is available in the market as a substrate, as the base. You can use sand, you can use mud. Your UV light being at a distance of about one to 1.5 foot. You need to make sure that you are doing lukewarm water soaks for them, just enough so that they can poop. So these things keep in mind. You can develop a hiding space for the tortoise in the area that you're, putting the cocoa substrate. Either a lot of people use big, large plastic trays, which works pretty well. You can do that. If you're talking about a turtle, your tank has to have UV light. It has to have a good filtration system. Your temperature has to be maintained between 28 to 29 degrees. These are common things that you need to keep in mind when you're with turtles. When you talk about snakes, snakes have like a heating pad put at the bottom. Then you have cocoa peat put. Your humidity should be around 75, 80. So, and your heating lamp has to be on. So everything is going to differ, but main is your heat and light and your hygiene are your three most important things when keeping reptiles.
Thank you so much, Doctor. Those are all the questions for today's session. And now I think we can conclude it. So, as we come to the conclusion of this session, we extend our sincere gratitude to you, Dr. Rina, and to Dr. Stalin as well, for sharing your valuable clinical experience and practical insights into exotic veterinary practice. We also thank all the participants here with us today. And thank you once again for joining, everybody. Thank you, Dr. Rina. This was a very
Thank you. It was
splendid
a pleasure talking.
presentation.
Thank you.